Hi, everyone, and welcome back to a new episode of LTC Heroes Live by Experience Care. Today, I am very excited. I am joined by Mark Francis, the Chief Product Officer at Electronic Caregiver. Hi, Mark. Welcome to the show.
Hi, thanks so much. I'm thrilled to be here. I've had a chance to watch a good number or listen to a good number of the episodes, and the conversations are just so compelling that it's thrilling to have an opportunity to sit down and have a conversation with you as well.
Yeah, thank you. And correct me if I'm wrong. I think you met Peter at a convention, correct?
Some of my colleagues met Peter, I think, at HIMSS, most
Yep.
probably, and
Yep.
then we
Hence,
started the conversation at that point. And as I jumped in and looked at some of the other episodes, there's a number of folks in which you have interviewed in the past that the people or the organizations are ones we're quite familiar with. So we're
that's
thrilled to be
awesome.
part of this wonderful company.
That's awesome. Thank you, Mark. Well, let's jump in right away with Electronic Caregiver. So please give us an overview of what you guys do, what you guys are, and of course, then what is your as the Chief Product Officer? What is your role there? What do you do?
Sure. Electronic Caregiver was founded in 2009. So we've been at this now for over 10 years. We're a telehealth technology and service company holistically. So we've evolved over time, just like many companies, as the market evolves as well. But we provide everything from technology solutions to be used to help manage, you know, uh, telehealth, televisits, chronic care management, remote patient management, engaging with residents in a long-term care facility, for example, all the way through providing a clinical triage center as well to augment staff to be able to look at the data that comes in, analyze it, and then to be able to do that first line of intervention to make sure that folks have access to care and that the insights that are coming through are looked at in a timely, proactive manner by a set of professionals to then take that load ourselves and then share with our partners those individuals who need a little bit more in-person or on-site care as well.
Awesome. That sounds wonderful. I know you just mentioned you guys work with healthcare in general, but you also do you have part that is focused on long-term care. In terms of the challenges that long-term care is facing right now, which is staffing shortages, compliance, quality of care, how does your service products can help and have an effect on those?
Yeah, it's really interesting. And that's one of the things you asked about my role. So I'm our chief product officer. So I work across the company to really look at what's our product and service offerings, what are the capabilities, the features of those products and services, and then kind of what's the associated roadmap with that as well. It all goes back to where, who are our customers, who are the end users of the products, and then what is it that they're asking for with technology based solutions as well. At the end of the day, technology, whether it's on the clinical side or the long term care side, is going to complement in person care. So, what can we do to be able to bring as many operational efficiencies and advantages through technology to our partners that we can? Your question is a really interesting one. I think it gets at the core of one of the challenges that we have, particularly in the United States, in that we have even after Obamacare, even after a bunch of different reform, we still have a bifurcated system. We have a clinical care system, healthcare, and then we have our, an auxiliary care system as well. That's everything from aging services, social services, companies that address issues or don't address issues regarding social determinants of health and long-term care as well, which is kind of bridging both some of that clinical side and non-clinical side. However, we look at it as we're looking at how do we create solutions that enable individuals to be able to live with the highest quality of life, the most independence, the most dignity, and the most engagement wherever they may be and with whom they decide to live with. That could be that they're aging in place at home. It could be that they're living in a senior housing facility. It could be that they're transitioning from a hospital to an acute care system into a long-term care system. For us, it's like, what can we do to get rid of some of the fragmentation and use technology to be able to create a more seamless experience for everybody?
Yeah, well, that's awesome. I think personally, I have to be honest, I am very average when it comes to technology, but anytime I find a solution that makes my day-to-day easier and my workflow just better, I'm just get so excited. So I can already tell that our audience are going to be very, very excited to hear what you have to say.
Sure, sure.
So
And yeah, and then particularly in the long-term care side, one of the things we've seen with some of our customers there, uh, were particularly during the time of COVID, there was a lot of concern about, are my residents safe? Is my staff safe? Is this a safe environment as well? So we heard across the board that a lot of the senior housing providers and other folks with whom we're working said there's a push to go more clinical. Yeah, even folks that maybe are running a hospice program, they were asked to go more clinical because people wanted to have the confidence and security that their loved ones were being looked after for holistically,
yeah.
and then also that it was a safe place for the resident, but also the staff. So we developed solutions that did, that provide, the contract tracing to provide daily COVID risk assessment as well, to make sure there's clarity in terms of whether or not a worker is safe to come in or not come in. To also to see, is there something going on with the residents that we need to be cognizant of to make sure that the person is safe and healthy. But then also, what if something is showing abnormal? How do you make sure that that person gets the support and the protection he or she might need as well? Because of some of the staffing demands that you see in the or and labor shortage you see in the industry, technology has a really nice opportunity to augment staff to be able to do some of the daily work that is very labor intensive that could be automated in a way that be able to, whether it's daily census to communication platforms to checking the health status on a resident, to be able to take all that information automatically through easy to use accessible technology, push it back to the care staff so then they can have a dashboard to take a look at things. So if I'm running a facility with 200 members or 200 residents, I can take a look at the dashboard in the morning at 9 in the morning, and I can see like, oh, 160 people have checked in, everything's okay. Oh, there's 40 people that maybe 20 of them haven't checked in yet. Let me go visit them to make sure that they're up and all right and they're okay. Or I have 20 more that indicated something that was out of norm for them. So then I'll focus my attention on those individuals as well. So it helps with compliance, it helps with reporting, and it helps with just providing a lot more transparency and enabling the staff that is there to be able to focus their actions, their attention, and their efforts where it's going to have the biggest impact and return for folks as well.
Let me ask you, does it integrate with electronic health records?
Yeah, it's kind of interesting. So we have a number of different solutions, everything from personal emergency response to a health hub called our Pro Health product. That then is what we do the remote patient monitoring on, that we pull in information on vital signs. You can do audio televisits. You can do a lot of medication reminders and stuff like that. These systems, we have then two dashboards behind them. One is a standard dashboard, for lack of a better term, that is used mostly in the non-clinical side. But it does pull information, has a census, has an ability to look in a risk stratified way in terms of how are people reporting, are they checking in, are there any trends of note. We have a clinical dashboard as well that is fully integrated into Cerner, Epic, Athena Health, tied into time tracking, tied into CPT codes for Medicare or Medicaid billing, and with an audit trail as well. So depending on what a provider partner or might want, they could sign up and use either the clinical dashboard or the non-clinical dashboard. We also have APIs that we can just push the information into another party's dashboard or their record system so that they can use everything in one place.
Wow, that's very impressive. And we're going to go a little bit later in the interview more into detail on one specific of your products, which is Addison Care. But before we get into that, let me ask you, I'm interested because when we have guests that work in healthcare in general, we always see that there are challenges that might not be the same as long-term care. So do you approach long-term care the same way you approach healthcare? Are there differences? If so, which ones?
Yeah, great question. There are certainly differences. So our business, we kind of break it into saying we have two different major market segments. One's a reimbursed market segment, which is usually around the healthcare side. There, it's a lot of things around telehealth, remote patient monitoring, chronic care management, audio, video, televisits, transitional care management. So we see a lot of reimbursed business on that side of this, our business. We then have about 15% of our business, which is private pay. That is usually taken to market through senior housing providers, private duty home care agencies, home health care agencies, and some direct to consumer as well. So while there's very differences, like we just talked about integration of electronic health records, on the clinical side, there's a couple leading providers that really dominate that market. On the long-term care side, it's much more fragmented. A lot of technology that has been adopted has been more about residential management and residential communication. They haven't yet started to integrate a lot in terms of the clinical side and the health side. However, when we look at, again, what we talked about at the beginning about our systems are designed to help people where they are, for us, whether someone is coming out of the hospital into a long-term care setting, staying in a long-term care setting, or perhaps transitioning back home, we don't care, but we do hope that we can create a solution and have partnerships across the care continuum so that folks can have a continual type of engagement and user interaction throughout their journey.
That's wonderful because I've heard a lot of people in this industry saying that they need more integration between their systems and technologies. So that's perfect, and it's actually a great transition into our next topic, which is innovation and technology. In your opinion, why whether they're big senior care communities or with senior care communities with less resources, why it's some or form or in some way they need to invest in technology, whether it's as small as an EHR to as big as adopting Addison Care, for example. Why is technology essential in this industry?
Yeah, I think what you're seeing is just like every other industry, the long-term care industry will go through the same type of digital transformation that we've seen across everything from, automotive to banking to every other sector that has as digital technology has worked its way through it. I'd say that the long-term care industry traditionally has been a little laggard in that regard. I think you've had some folks have been really early adopters that have gotten out in front and have experimented a lot in the space. Prior to joining Electronic Caregiver, I had been part of the digital health team at Intel. And there, when we were launching our digital health solutions, we helped found an organization associated with leading age called CAST, the Center for Aging Services Technology. And there we had a lot of really innovative companies getting ahead, like 15 years ago, getting ahead of things and really trying to say, how can I adopt technology to augment my care, to augment my staff, to provide data that's going to provide me a richer array of insights in terms of how my resident is doing and what type of services and support he or she might need. I think two things happened. One is, frankly, the technology infrastructure was immature and not ready to be adopted at scale. I think that's changing now. For example, if you look at long-term care, a lot of the housing infrastructure is aged and old. So it wasn't really designed to, actually deploying Wi-Fi, for example, became really expensive and really hard because of the way systems were designed. Well, now you basically have ubiquitous cellular connectivity. So now a lot of those issues that had a lot of labor or infrastructure costs associated with them have been basically sidestepped because of the proliferation of cellular technology, mobile technologies, whether it's smartphones or tablets, and the ability to be able to quickly be able to provide support in a whole array of different ways for the industry. So I think you're seeing more adoption. I think what we saw was most of the technology has been adopted again more in the residential management side, facility management, and then resident communication, and a lot of experimentation in terms of how can I use sensors around tracking my residents' health activities, that might be related to census and compliance, and also with issues around falls or falls mitigation or falls tracking for an insurance purpose. And now again, in the aftermath of the beginning of COVID, the desire to go more clinical is now driving the decide, say, well, if I need to go more clinical and get more clinical insights, how can technology help enable that without me bearing another big staffing expense on top of what I'm already bearing right now?
Yeah, actually, my next question was, has COVID had a big impact on that? Because it's true that COVID was a huge impact in long-term care, but in healthcare in general, in the adoption of technology and wanting, to implement new things. So, what are the things that you've seen that? What are how are demands changing pre-COVID and now post-COVID? What are people looking to implement more?
Yeah, I think one of the good things for the long-term care industry is it's going to have an opportunity to benefit for what we've learned on the traditional healthcare side as a result of COVID. So going into COVID, late 2019, a lot of technology that's being used now around telehealth, the technology already existed. It just wasn't being adopted. It wasn't being adopted because of the provider resistance, an assumption that patients wouldn't want to use it, and that turned out to be a false assumption. But then, frankly, because of lack of reimbursement. So it was really hard to get these technologies paid for in the healthcare system. And in the US healthcare system, which is a fee-for-service system, mostly if it's not paid for, it's not going to get done. So COVID, upset the apple cart there. People weren't going in. The ability to connect with the patients remotely was forced upon the system. So a lot of these technologies, which were on the sideline, got adopted en masse, which was fantastic. And then correspondingly, the reimbursements changed as well. So what we saw then was a massive use of these technologies. And then what we found out is that A, the patients really liked it. B, the providers actually liked it as well. C, a lot of the social determinants of health, things around access to care, transportation, some of those issues got pushed to the side because you had the ability to be able to see the doctor on demand or the nurse on demand. So that was great. I think what's happened now as we're looking forward is that we're moving into an era that's going to be much more of a hybrid model of care. That obviously for a lot of things you need to be, with a care provider, whether it's a clinical provider or a non-clinical provider. But then there's a lot of other stuff that can be directly or subtly obtained by the use of technology remotely. So I think that's what we're seeing moving forward is that model. And I think a lot of things that that were experimented among in the last 2 years and then found to be more effective than others on the traditional healthcare side are those solutions that can be adopted more quickly on the long-term care side.
Yeah, I like it that you said that the hybrid model. We're gonna go back into that a little later. For now, I just want to quickly take this opportunity to thank our sponsor of the show, which is Experience Care, the most configurable and intuitive EHR on the market. So if you want to learn how you can improve your efficiency and quality of care, please visit experience.care/guarantee. So now, Mark, going into more innovation in technology, let's talk about Addison Care. So first of all, let's just start by explaining what is Addison Care and how is it going to impact the long-term care sector, the healthcare sector in general, and then also the long-term care sector.
Sure. Addison Care is a labor of love that was started by Tony Dorman, the founder of Electronic Caregiver, about 10 years ago. So Tony is somebody who is a serial entrepreneur, had been doing some work in the home security market, had a company in that space, then saw opportunities in the personal emergency response space as well, started offering some solutions there, but then really said, this is really the tip of the iceberg in terms of what we could do in terms of creating smart health or our smart healthy homes. So someone who is in the space and also is a inventor himself with multiple patents, saw an opportunity to say, hey, you have all these developments that are happening in other industries, gaming in particular, entertainment, around mixed reality, augmented reality, virtual reality. What if we're able to bring some of those technologies to bear at home and create a virtual caregiver by the name of Addison? So that set about, about 8 years ago now, a partnership with New Mexico State University to create a basically 360-degree immersive technology lab to say, what would it be like to be able to create a virtual avatar that could be with somebody 24 hours a day and be their companion at home, to develop a trusting relationship and a deep engagement to help keep them healthy and at home. So then we spent, over half a decade investing in the technology, experimentation. We went around the world to be able to do some ethnographic research to talk to patients, providers, long-term care providers, family caregivers, to really understand what their challenges were, what the needs were, how receptive they might be towards something like this. If it was developed, is it something that should be accessed through a cell phone or through a tablet computer or through a TV? Really testing out a lot of different ideas. And then what are some of those core capabilities as well? So along the way, started to develop a bunch of different prototypes, and then came to a point that saying, yes, there is a need here. It's going to address issues around staffing. It's going to address issues around social isolation. But most importantly, if we want to drive outcomes, whether it's on a clinical side or a behavior side in a non-clinical setting, you're never going to be able to change outcomes unless you have engagement. So you can have the best solution in the world, but if no one uses it, it doesn't make any difference. So, like for example, right now you have, $300,000, 300,000 health apps in the Apple Store. Usage for any one of them within 30 days is like under 1%. So it appears clearly that an app-based solution, particularly if you're targeting an older population, might not be the way to go. Something that's more intuitive, engaging, that doesn't mean navigating things on a little button, uses voice technology and visual analytics, is something that we believe is much more where the future is going to lie. So when we started building Addison, we said, let's look at what's happening in the market, particularly let's looking at what's happening with all the voice assistants. And what if we could put a face to a voice assistant, a face, a personality, a name, and really have that next level of relationship and engagement. And that's what we've been developing with Addison and Addison Care.
Yeah, I thought this was amazing. The first time I looked at it was after our prep call a couple of weeks ago.
Yeah.
The first time I looked at it, I thought it's something that you see growing up kind of like in futuristic movies, but it's actually happening. It's now, it's already out there. It's crazy that these technologies are available today. So take me, you talked a little bit about the development process of Addison and how it came to be. What are some of the technologies you're using in this solution?
Sure. So we will be taking so Addison's undergoing kind of last mile of user testing right now. We spent a lot of time looking at what's the right launch features, what's a feature roadmap, what technologies to use as well, on what type of form factors should we launch the product. So we're going to be officially launching Addison later this year. It's going to come out on an all-in-one in a tablet form factor. So, larger screens, more dynamic and interactive touch displays. We are going to be using, computer vision technology through the cameras that are in the devices. That's going to enable us to be able to look at someone's face, see whether or not they're showing signs of lack of sleep, subtle signs of a stroke, whether or not they're anger, anything that's upset. You can actually use the cameras to be able to start pulling vital signs information as well. So there's a whole bunch of information that we can obtain through the cameras just to be able to get a baseline on somebody, and then to be able to track holistically over time how that might change as well. We're also using the cameras for identification. So we're not going to make sure anything is displayed that might be personal health information for me if you're the one in front of the product, and vice versa. So we're going to make sure that we can confirm that the right information is being displayed to the right person. We're using the cameras to be able to do visual confirmation of medication consumption as well. So it's one thing to ask somebody or give them a reminder to take medication. If you can also augment that with kind of a visual indication that they have taken their medication as well, that'll be fantastic. The screen in the camera also enables us to be able to teach both the resident or the patient as well as staff different care routines as well. So whether I'm in someone's room in a facility, I need to turn a patient. Maybe I haven't done that for a while. I might have learned of it when I was in school, but I haven't done it for a while. You can bring up a tutorial in terms of how to do that. If I'm a patient, I need to take my blood pressure as part of a care management routine, and I'm not getting a right reading, you can go and look at what's the right way to affix the cuff as well. And then also what we've done is we've used our studio to be able to do a lot of different model making around a whole bunch of different occupational health routines. So if you have somebody who has to do something that might be related to yoga, occupational health, they can see Addison doing the routine. Addison can see him or her doing the routine, and then we can match it up to see whether or not it's being done accurately as well. So we're using the cameras in a lot of different ways. The interaction is both voice as well as touch. Having a touch screen and a larger display enables us to be able to provide care plans for somebody. So we're providing contextual based engagement. So if you have chronic heart failure, for example, it's one thing to ask you to take your, what's your weight, what's your blood pressure, what's your pulse. It's another thing to be able to do it in the context of an engagement that greets you by name. If it's your birthday, says happy birthday, gives you a reminder of why taking a measurement is important, can provide you your history, gives you an acknowledgement, encouragement if once you've done it, gives you rewards if you've done it 7 days in a row or 2 weeks in a row.
Yeah.
So there's a bit of gamification in it as well. So again, and then behind all of that is something called Addy, which is our platform as a service. And there we have a data engine that we're digesting all this information, running analytics on it as well, and then being able to tee that up to a partner, clinical or non-clinical, to say, hey, for Mark, here's how he's doing. And if it shows green, everything is great. If it's starting to show some signs of something trending in a direction that we might want to be watching, there'll be some things that tag yellow. And if there's something that was just really unusual or is in a high acuity alert, it would be tagged red. So we have that available to be able to help. The other thing we've done is over the last 6 months, we've hired 150 people and have built out a clinical triage center. So again, one of the things, and we've staffed this with RNs, CNAs, geriatric care managers, care coordinators, because one of the things we saw was that there was a gap in terms of the desire to provide these type of solutions and the personnel to be able to provide these type of solutions. So what we did is said, well, if that's a need, we'll take on building that capability and training that staff. So now we have an ability to go to a long-term care provider and saying, here's a suite of capabilities we offer. Everything we do in our Premier Pro Health product are embedded into Addison. So you can have that all and more on an Addison solution, and also use the APIs to integrate it into your facility management or your residential communication system, and have one platform to be able to touch your residents holistically, and to be able to do that, with high organizational, efficiencies. On the healthcare side, we've had some folks go from, not using technology and having a patient load of 30 to now using technology to have a patient load of 200.
Oh, wow. Wow. Impressive. And I like that what you said about getting for CNAs and RNs to get in touch with that technology and start using it, because it goes back to what you said about hybrid model of care.
Exactly.
Incorporating real people, but also with the help of the technology to improve compliance and improve the quality of care overall. So I think it's wonderful. I'm really excited for you guys. It sounds so very impressive.
Yeah, and we're very open to say, what do our partners, so we have our own roadmap, but it's like, what do our partners want? So example, we've talked to a lot of private duty home care agencies, and they said, what we'd really like to be able to do is, can we add to Addison the ability for the caregiver to check in, for him or her to be able to take a look at perhaps some notes, and for him or her to be able to check out as well, and send some notes at the end of the visit as well. So that would add a lot of value to them. So we can do that. We also have the ability in a situation like that to use the camera subtly, the camera and the microphones, to be able to say, is there signs of any kind of elder abuse as well? So part of it is what we want to do is to be able to make sure we bring solutions that are meeting the needs of the senior, mostly senior end user, but also the provider with whom services are being provided to that individual as well.
Yeah. That sounds really really awesome. Go to start wrapping things up. I know you said that the future of kind of this technology is looking more into like a hybrid model, and I do want to go a little bit more into that because I wanted to ask you, what do you think is going to look like the future of technology for healthcare and long-term care? What are the things that people are going to be using 3-5 years from now?
Yeah. Um, well, I think our biggest challenge, if we're moving to a hybrid model and we're moving into a value-based model, that the long-term care side of the equation gets the respect, attention, and resources needed to be a true partner in terms of someone's care holistically. Because historically, the clinical side has got all the resources, and then they kind of just hand things over to the long-term care side, which is often under-resourced, undercompensated, but doing, the yeoman's work. And frankly, what we've learned, they're doing the work that actually drives about 90% of someone's health status. So there needs to be more balance there. I think a great model of that is there's a program called PACE, Program for All-Inclusive Care of the Elderly. It started over 20 years ago as a kind of an experiment. For about 15, 17 years, it remained a little tiny experiment and then finally got fully verified as an acceptable HMO model. And what's really interesting about PACE is that includes all the clinical side, all the social aging services side, and in most cases, housing as well. And you have a fixed pot of money. So what that does is it enables the providers of the services to look holistically and say, well, if I invest more on the long-term care and support services side, I'm not going to have as many people that might have a decompensation and might have to go into a hospital or an expensive acute care setting and stuff like that. So these models and the results that are coming out of that are really, really interesting because they're able to provide, basically proof points and economic proof points that investing in long-term care makes a big difference, provides better outcomes, can save the system money, particularly if you look at things, holistically, which is where the
Yeah.
value-based care model is supposed to be going. Technology can help a lot because whether it's a clinical side or non-clinical side, there's massive staffing challenges. So the degree in which an Addison, for example, can augment human staff to be able to be there, daily to check on how someone's doing, to have a dialogue, to facilitate a dialogue with the clinician, and then to be able to tee up a request for clinical or non-clinical services at the right time makes a big difference and can really bring a lot of operational efficiencies. So you have the added value of being there every day, but then you're augmenting that not blindly, but based upon real data and real results. So I think you have that. I think we're going to have a system that, 10 years ago, very few houses had like a Nest thermostat or a Ring camera out front. Now that's starting to become standard. I think we're going to have I think the future builds in long-term care are going to be incorporating these type of technologies, whether they're sensing technologies across the house to be able to start pulling ambient information, whether it's a type of display information with a virtual caregiver like an Addison that takes a voice assistant to the next level. I think that's going to permeate what's offered in long-term care moving forward, because I think that there's a realization that, again, direct engaged technology and ambient technology is now mature enough and affordable enough to be able to provide insights in a way that's going to augment and add more value to staff without adding to an economic burden to the industry.
For sure, for sure, and that's are the biggest challenges right now that the industry is facing. So, yeah. So to right, the last question that I want to ask you, and I like to ask this to every guest, is how do you keep yourself informed about the newest technologies that are coming out? And how do you have a specific blog that you like to go, podcast, journal, anything that people can keep track of what's coming out?
Sure, great question. And that's one of the things I most enjoyed in some of the other episodes I was listening to. I was taking some notes of what other people go to. For me, there's a handful of things I usually receive every day, and I look at them. One is Becker's Healthcare has a report. Fierce Healthcare has a report. Parks Associate does both some conferences and some industry reports that are fantastic as well. Some of the investment banks have really good, big, mega industry reports as well. McKinsey, the consulting company, has taken a more of a strategic focus in this space as well, which is great. From an investment perspective, Rock Health is really interesting. Organizations in which we participate in is we do attend HIMSS and participates in HIMSS. We find, frankly, more valuable are some of the things like Leading Age, both on a national level and also on a regional level. We do the American Telehealth Association as well. We find those things to be really good resources. And then we also see there's a lot of lessons that can be pulled from other industries that now can be applied here as well. So sometimes our reading lists are not industry specific, but more maybe around leadership, technical innovation, product development, which then we can take those lessons and say, how do we apply it here?
Of course. I love that. I love that. Thank you so much, Mark, for joining us today. It was such an insightful interview. I'm pretty sure everybody is going to be so excited for Addison to come out. Thank you so much again. And for everyone watching us, thank you so much for joining, and we'll see you in the next episode.
Thanks so much. It's been a pleasure.
Thank you.